Dr. Juyia at Elite Women's Care, where we provide gynecologic services to people of all ages. Today we're going to talk about STDs, also known as STIs.
Dr. Juyia, what is an STI?
STI stands for sexually transmitted infection. These often don't have any symptoms, and which is why we recommend screening for them often in people in high-risk groups.
When is a good time for me to have an STI screening?
A good time to have an STI screening is any time a person is concerned. Meaning this could be regular intervals for people that are considered high risk solely by their age group. The CDC recommends everyone under age 25 to be screened at least yearly. But then of course, anytime a person has a new partner or a concern, STI screening should be repeated.
What can I expect during my STI screening?
An STI screen is really a minimal type of appointment. Sometimes people who really have no other questions and simply want to be screened can come by with a nurse visit and drop off urine even. It doesn't have to be invasive at all to keep you safe.
What are some common treatment options for STIs?
Treatment options for STIs differ, of course, according to which STI we're working with. Interestingly, the CDC just updated their guidelines for gonorrhea and chlamydia. And so it's important to know that your physicians are always following the latest guidelines to cure if possible or manage if necessary.
How can I tell if I have an STI?
STIs often have no symptoms, which is why screening isn't so important. Other times people might know they have a concern and may have an STI because they have abnormal discharge, discomfort with urination, or maybe some new blisters or lesions on the vulva.
What are some of the more common STIs?
There are essentially two main groups of STIs, viral and bacterial. Bacterial are the ones that people most often think about, like gonorrhea and chlamydia, and these are ones that we can cure. More uncommon is something called trichomonas, which is actually an amoeba, if you want to categorize it, also treated with antibiotics and curable. Then the viral ones are something that we manage, herpes, HSV. This is the same virus as what causes cold sores, and there's two strains. Either can be actually genital or oral. And then there's also HPV. This is the most common infection. It's viral. Most people who have ever had sexual contact do have HPV, and that's why we screen for it with pap smears.
What is the best type of STI prevention?
The best way to prevent STIs are to take care of yourself and to be careful, insisting always on barrier options such as condoms or dental dams when sexually active with another person. To learn more about our practice, please give us a call or visit our website or Facebook page.